Hello, I'm Philip Ward, Editor-in-Chief of AuntMinnie Europe. Good software is vital to the practice of medical imaging today, which is why in the EuroMinnies award scheme, we have a special category for Best New Radiology Software. That award has been won for the last 2 years by Philips Healthcare. So what's their magic formula? To explain all, Kevin Lev from Philips Healthcare has joined us today. Thank you very much for sparing the time to talk to us, Kevin.
Pleasure to be here. Thank you very much for the opportunity.
Could you start by updating us on how things are going? Is your product available worldwide now?
Yeah, so the IntelliSpace Portal version 12 was launched at RSNA, and what we typically do is have a short, what we call first of kind period, where we have the opportunity to get the product out to a first set of customers. Because this is one of our most robust versions of the product to date, we want to make sure that the functionality of the product works very well, that it's meeting the customer needs. It's been tested in various different scenarios before we can release globally and before we can release for a broad audience. And that's expected to be on schedule for us in June of this year, where it'll be available globally with the exception of China, but generally available for most markets.
Okay, now no software is perfect when it initially comes to market. I think everybody knows that. Have you made certain modifications to the product since RSNA?
So I'll say, actually, in this version of the product, we've been able to bring major enhancements even after the launch to the product to the degree that we could from a regulatory perspective. We've enhanced a NeuroQuant, which is one of our capabilities that we in-license. I mean, the IntelliSpace Portal is great at not only bringing internal innovation, but really bringing the best of software that we can find out there in a common platform to meet customer needs. So we have an updated version of NeuroQuant. We've also harmonized our user interface with a lot of our different applications based off of user input, so that now you're going to see a common thing that helps radiologists with easier on the eye. For, as we know, in a lot of radiology suites is darker, so we needed to adjust our theme, which helps also improve the workflow for them as well. We've also incorporated over 40 different inputs that we've received from our customers, right? So Philips is very attentive, especially during that first of kind phase, and to the broad net of customers that we already have, to continuously incorporate new innovations into our product line. So 40 is no small number of new innovations that we've been able to bring of enhancements to existing applications. So we're happy to bring that to our customers as well.
Very good. Now, our viewers and listeners are radiologists, many of them. They will want to know the clinical benefits of the product. Could you just outline those clinical benefits for us?
Sure. So, typically when we're dealing with an advanced visualization solution, we're dealing with some of the most complicated cases out there that the radiologists have to look at. These are longitudinal cases that have an immense amount of data, right? And so the challenge is going to be, how can I provide the greatest amount of insight by also without necessarily adding time to the analysis? I mean, we know that with a huge influx of studies that are now coming in the, you might say, post-COVID era, radiologists are having to deal with more and more studies than ever before. And so time and quality becomes an interplay. And that's what the benefits of Portal, the IntelliSpace Portal does. What it really does is it enhances the insights that we can bring with deep clinical knowledge in every application that we have across our portfolio of over 70 applications, but also adds a high degree of automation. We've incorporated a significant amount of AI into this version of the portal, more so than any other product that we actually have in Philips, in order to help automate some of our processes, provide insights in graphical formats and visual formats. And finally, one thing that we've also done is added a photorealistic capability that allows the radiologists to not only be diagnosticians, but also utilize 3D formulations, new ways of looking at anatomy to help out with post-surgical planning, and even to become communication channels with the patients themselves, who can better understand what's going on if they can visualize it.
Okay, now which therapeutic areas in particular are you finding that this product is particularly useful for?
So with every version of the portal, we end up having a particular clinical focus. In this particular version of the portal, we've focused a little bit more on cardio and cardiovascular capabilities. We're starting to see a huge influx in interest in applications like 4D flow, in a reinvigorated interest in MR cardiac. That's also that being reflected in some of the guidelines changes. So there's a large interest in cardiology, but that doesn't mean that we also haven't touched upon so many other different clinical areas. With a product portfolio as vast as 70 different clinical applications, what we also try and do is touch as much as we can to provide updates and insights and even new applications in areas like oncology, in areas like neurology, and general usage as well. So
Okay,
cardiology
good.
focus, but going beyond.
Excellent. Could you tell us a little bit about the development effort that was involved? How many people took part in this project, and how long did it take?
So we have broad Philips teams. I can tell you exactly how many people, but we have a very broad Philips teams that actually spans the globe. We have teams that are giving us clinical insight from our CT and MR groups, from a lot of our other modalities that provide insights. We consult with them as well. We have a development team here in Israel and the Middle East. We also have in India and in the United States. So I view it very much as a global effort. Which is actually harmonizing and bringing together the best of minds from all over the world at around an 18-month cadence or so 18 to 24 months or so, where we're able to provide new insights and new innovations to our AV platform on top of the annual software releases that we also do just for level releases.
Okay, very good. Can I ask you a little bit about your own country, about Israel? And people are talking about it as the new Silicon Valley in the world. Do you think that's a fair description of Israel?
So, it's interesting. There was a book that came out a little while ago called Startup Nation. I urge everybody to read it. I think it's interesting because it really gives a sense of what are the cultural elements that allowed for Israel to become a hub in the world of AI. And it has to do with some of the same things that we've been seeing with what led to the Silicon Valley originally in Northern California. Things like questioning of the norm, not necessarily taking the status quo as is, taking a propensity for risk, for instance, okay? And also the fact that we very early on are not necessarily reliant on some of our immediate neighbors in order to be able to have trade and commerce. So we very quickly became also a knowledge-based economy. It's also reliant upon the fact that there's some of the highest per capita amount of people who are trained with university degrees, and a lot of them are focused on computer science as well. So I think the combination of a lot of that allowed us to really start to capitalize on newer technologies, which is why you see even some of the early technology running cell phones, some of the original CT technology originally came out of here as well. We have over 900 startups in AI, and also I think the reason for why it's moved in that direction is because we have those 900 startups. They're not just focused in one area. They're not just focused within healthcare. They're also looking at areas where we're only beginning to understand what the benefits of AI could entail, such as in areas of transportation, in finance, and so I think it becomes a hub of new innovation that way.
Certainly. I mean, the other thing that you're very famous for in the world at the moment is your vaccination program that for COVID-19 that you're cracking on very well on that. Could you give us a quick update on that, on how the vaccination program is going in Israel?
Sure. Actually, interestingly, IntelliSpace Portal includes one of the first applications that was developed in record time for detection of COVID in our patients as well, that can be used for follow-on prognosis. So it's even incorporated within this product. But yeah, overall, over 60% of the population has been vaccinated. There's a huge drive and a lot of push to be able to make sure that people were vaccinated. I myself have been vaccinated, and the experience was incredibly welcoming. We kept distance of 2 meters between people. It was in and out within 10 minutes that we were able to get the vaccine. And because of the fact that we also have a nationalized healthcare system, everybody's recorded. It's a lot easier to kind of maintain and understand what happens with patients as they move on. And also, it's also become part of a social responsibility in a certain sense, where in order to go to restaurants now, they will check to see if you have, or even to go on public transportation.
So you have that on your phone, do you? You have a vaccine passport on your phone that?
Yeah, correct. So a
We
lot of us,
see that. I suppose it's a green light and a red light.
yeah, that's mine.
Yeah. Yeah.
There we go. So a
So,
lot of people have this on their phone.
so if you go into the local restaurant, the local brasserie, you have to show this to you.
Yeah, and that's the way that you know, to engage again in social activities is in encouraging people to then vaccinate, which we understand helps not only ourselves but helps the people around us as well.
What sort of age group are you down to now? Are you down to teenagers yet and young people?
Yeah, so they've already started vaccinating people from 16 and up, and they're only beginning to test whether or not we can do it for younger age groups. But yeah, we're starting to move down to that level as well.
Excellent. Now, looking ahead towards later in the year, there's obviously HIMSS on the horizon. I think it's now scheduled for August, and it may be a face-to-face meeting. Is that what you've heard yourself?
We've heard that it might actually be a face-to-face meeting, which is very encouraging. It gives us the opportunity to then re-engage with our partners, with our customers, with the clinicians, and it's nice to hear that there's a good chance that the world might be moving closer to a place where we, with the proper restrictions and understandings, and having a better informed view, hopefully can get back towards a more close engagement. And hopefully if we see that for HIMSS, we'll see it for other conferences.
Excellent. Could you give us a few pointers for aspects in the products in the pipeline that Philips have got in your area?
Sure. So as we continue to look at different areas of new innovation, obviously AI is a very large component of what we see as an upcoming driver within the world of healthcare, helping support the overall strategy that Philips has. So not as a separate, not as a separate strategy, but really helping underpin what Philips stands for. So we're incorporating AI-based concepts into upcoming scanners that I'm hoping we'll see in the marketplace. The opportunity of being able to leverage the huge amount of innovation that we see worldwide and create and provide access to ecosystems of innovation as well, hopefully integrated with our products that you'll begin to see coming at our upcoming releases.
Okay, Kevin, thank you very much for joining us today. I've appreciated your time. Best of luck with all your efforts, and many, many congratulations again to you and the team at Philips for this award.
Pleasure. It was a group effort, and this is part of I want to say thanks to all the people who have contributed to getting us here within Philips and beyond.
Very good. This is Philip Ward from AuntMinnie Europe signing off.